Dyspepsia is a term that describes pain in the upper abdomen, also discomfort. And to some of you, it's also known as indigestion. Very important notice, it is not a disease. You are not sick. You are not gonna die. Although sometimes... Okay, you're probably not gonna die because we can treat it with a lot of drugs. And when I say a lot of drugs, I mean a lot of drugs. And in this video, I am going to give you 5 different classes of drugs we can use. That is 5 different mechanisms we can use to treat that excruciating pain you are experiencing from time to time. And whilst you are digesting the content, you might also consider dropping a like. And keep in mind, you should never, ever, ever self-medicate without consulting your pharmacist first, because he knows about your other therapies, other drugs you're taking, and he can adjust your therapy as well. Spoiler alert, these drugs do interact with each other and some other drugs. In at number 1 are antacids. When you are experiencing stomach pain, antacids are probably the first thing you're looking for around the house because A, you probably have some, and B, it relieves the pain when you take them. Why am I so sure that you have some around the house? Well, if you are cooking or baking, you probably have baking soda around your house. And baking soda is not just used to make treats, but it is also a base that can neutralize acids such as, wait for it, stomach acid. If baking soda or sodium bicarbonate is your weapon of choice against the pain, you might wonder, how much should you take? Good question. And the answer is your drug dealer's favorite number, 1 gram. Now, I'm pretty sure you cannot measure 1 gram precisely, which is why I'm gonna share the advice that my pharmacist gave to me. You take the tip of the knife, you take some powder, and you dissolve whatever it is on the tip in a glass of water. That is, tip of the knife, take some powder, dissolve it in a glass of water. If this amount does not help, it is probably a good idea to contact your doctor. Also, if the symptoms last for a couple of days, it is also a good idea to talk to your doctor. Of course, baking soda is not the only antacid available. There are also a couple of aluminum-based, there are also a couple of magnesium-based, and they have quite different side effects to them. In the end, let's summarize antacids. They are quick to act, they're cheap and accessible. They won't last that long as some others that I'm going to talk about later, but for the most part they do the job. The second class of drugs that I want to discuss are H2 receptor antagonists. This class is quite hardcore. It is so hardcore that one of the representatives is actually removed from most markets. That's how hardcore they are. Instead of neutralizing the acid, these drugs reduce the production of the acid, which makes them more potent and their effect lasts longer than antacids, although it takes time for the effect to kick in. Super cool. The increase in potency does not come without a trade-off. They reduce the potency of antibiotics, they reduce the potency of non-steroid anti-inflammatories, and they also reduce the absorption of vitamin B12 and omega-3 fatty acids. Oh yeah, and you can't use this if you have gastrointestinal bleeding, and in case of an ulcer, it is the exact thing that caused the pain in the first place. Isn't that funny? Next class, proton pump inhibitors. The name actually sounds really badass. On a more serious note, if you take enough of these, you can actually stop the production of the stomach acid completely. And it is also proved through clinical trials that if you use PPIs as a part of your ulcer treatment, that the ulcer actually heals faster. It is probably not a good idea though to use this if you have pseudomembrane colitis or if you have an impaired liver function, because it cannot metabolize, which is bad. Also, the same drug interactions are present here, and because they are more potent, meaning they can actually stop the production of stomach acid, the interaction is even more severe. Class number 4, propulsives, or some of you may know them as prokinetics, either one's fine. Propulsives stimulate stomach wall muscles, and in turn those muscles move the stomach content forward. That means you take these when your pain and nausea are accompanied by the feeling of a full stomach. I actually have some right here, as you can see, and the pharmacist was very reluctant to sell me for a good reason. They are quite strong, they're quite potent, and they interact with loads of medicine. So if you don't know what you're doing, you might cause more harm than good. You might have depression, you might have seizures, or something a little more common like hypertension. In either case, the use of these drugs is a big no-no. And the last thing that I want to discuss are antibiotics. Antibiotics are used to treat bacterial infections, and there is one in particular that can cause dyspepsia, and over time, if not treated, can lead to ulcers, and that's Helicobacter pylori infections. If your symptoms are not gone after 2 weeks of treatment, it is probably a good idea to test yourself if you have the infection or not. And you might be surprised, you might not be surprised because you've already heard this, but 1/4 of the population has it without even, lots of people don't even know they do have it. From time to time they experience a little pain, nausea, whatever, and it passes. But sometimes it can cause serious problems, and it is important to eradicate it. An important message that I want to send at the end of this video is don't use antibiotics unless you have bacterial infections and unless your physician has prescribed the medication to you. You can create some resistant strains, and then you endanger your health and other people's health. So only, and please only, if your physician prescribes them to you. So let's see, antacids, H2 antagonists, PPIs, propulsives, antibiotics. That's 5. I guess that's it for today. I hope you liked this video. Please leave a like if you did. Subscribe if you want to follow more content. And I guess I will see you in the next video.